Hi everyone, I am Vanessa Rosales, a medical technology student of Butuan Doctors College. This is my case study for idiopathic thrombocytopenic purpura. After initial reports by the Portuguese physician Amato Lusitano in 1556, Lazarus de la Riviere in 1658, it was the German physician and poet Paul Gottlieb Werloff who in 1735 wrote Paul Gottlieb Werloff, who in 1735 wrote the most complete initial report of the purpura of idiopathic thrombocytopenic purpura. Platelets were unknown at the time. The name of Werloff's disease was used more widely before the current descriptive name became more popular. Platelets were described in early 19th century, and in 1880s, several investigators linked the purpura with abnormalities in the platelet count. The first report of a successful therapy of ITP was in 1916, when a young Polish medical student, Paul Kasnelson, described a female patient's response to a splenectomy. Splenectomy remained a first-line remedy until the introduction of steroid therapy in 1950s. Purpura, initially recognized in ancient times, was defined into clinical syndromes in 16th, 17th, and 18th centuries. With advances in microscope science in the 19th century, the platelet was identified, leading to the recognition of the thrombocytopenic component of the idiopathic thrombocytopenic purpura. The 20th century brought recognition of the pathophysiology of the disorder, and the clinical states were refined and treatments of ITP developed. The latter half of the 20th century has focused on the autoimmune components of ITP, attempting to develop diagnostic tests, apply new therapies, and elucidate the immune dysregulation associated with and underlying the disorder. What is immune thrombocytopenic purpura? Immune thrombocytopenic purpura is a blood disorder characterized by a decrease in the number of platelets in the blood. Platelets are cells in the blood that help stop bleeding. A decrease in platelets can cause easy bruising, bleeding gums, and internal bleeding. This disease is caused by an immune reaction against one's own platelets. It has also been called autoimmune thrombocytopenic purpura. Thrombocytopenia means a decreased number of platelets in the blood. Purpura refers to the purple discoloring of the skin as with a bruise. ITP is a fairly common blood disorder that both children and adults can develop. There are two forms of ITP: acute thrombocytopenic purpura and chronic thrombocytopenic purpura. Acute thrombocytopenic purpura, this usually affects young children ages 2 to 6 years old. The symptoms may follow a viral illness such as chickenpox. Acute ITP usually starts suddenly, and the symptoms usually disappear in less than 6 months, often within a few weeks. Treatments is often not needed. The disorder usually does not recur. Acute ITP is the most common form of the disorder. Chronic thrombocytopenic purpura. The onset of the disorder can happen at any age, and the symptoms can last a minimum of 6 months, several years, or a lifetime. Adults have this form more often than children do, but it does not affect adolescents. Females have it more often than males. Chronic ITP can recur often and requires continual follow-up care with a blood specialist. What causes ITP? The term idiopathic, used in the former name of the condition, means of unknown cause. In the past, it was used because the cause of ITP wasn't well understood. However, it's now clear that the immune system plays an important role in the development of ITP. Thus, its newer name, immune thrombocytopenia. In ITP, the immune system produces antibodies against platelets. These platelets are marked for destruction and removal by the spleen, which lowers the platelet count. The immune system also appears to interfere with cells responsible for normal platelet production, which can further lower the number of platelets in the bloodstream. In children, ITP often develops acutely following a virus. In adults, ITP usually develops over time. ITP can also be classified as primary, occurring alongside another condition. Autoimmune diseases, chronic infections, medications, pregnancy, and certain cancers are common secondary triggers. ITP isn't contagious and can't be passed from one person to another. Definition of terms. Pathophysiology.
Learning medicine is hard work. Osmosis makes it easy. It takes your lectures and notes to create a personalized study plan with exclusive videos, practice questions, and flashcards, and so much more. Try it free today.
Immune thrombocytopenic purpura, or ITP, is an autoimmune condition in which the body produces antibodies against its own thrombocytes or platelets, which are destroyed. And this results in purpura, or small bleeding spots beneath the skin. Normally, when there's any kind of damage to the blood vessel, hemostasis occurs, which is the process that stops the bleeding and plugs the damaged vessel to limit the blood loss. And there are two steps, primary and secondary hemostasis. During primary hemostasis, platelets aggregate to form a plug at the site of the injured blood vessel. Platelet aggregation is mediated by surface proteins found on platelets, called GP2B3A receptors. While these platelets are aggregating, secondary hemostasis kicks in. Secondary hemostasis is also called coagulation because that's when clotting factors come into play one after another, with the ultimate goal of cleaving fibrinogen into fibrin. Then, fibrin forms a protein mesh, kind of like a giant net, that covers the platelet plug and stabilizes it. Now, in ITP, the spleen produces certain IgG autoantibodies which bind to the platelet receptor GP2B3A and targets the platelet antibody complexes for destruction in the spleen. This leads to lowering of platelet counts in the blood, which makes it harder for bleeding to stop. Now, ITP can be acute or chronic. Acute ITP usually affects children a couple weeks after a viral infection and resolves spontaneously within 2 months. Chronic ITP usually affects females of reproductive age and persists more than 6 months. Chronic ITP can also be primary when it occurs without an underlying trigger, or secondary when it's triggered by another condition like hepatitis C, HIV, or lupus. Most of the time, ITP is asymptomatic. In some cases, it can cause purpura, which are red or purple spots on the skin, measuring 0.3 to 1 centimeter in diameter. In severe cases of ITP, when platelet levels get very low, there may be frequent mucosal bleeding, which most commonly presents as epistaxis, meaning nosebleeds. ITP is a diagnosis of exclusion, so there is no specific test that confirms the diagnosis. Interestingly, the CBC usually shows isolated thrombocytopenia with a normal hematocrit and leukocyte count. Now, in some cases, if there's significant bleeding, that can lead to anemia. An abdominal ultrasound is often done to rule out splenomegaly, and hepatitis C virus and HIV testing are done to rule out secondary ITP. Individuals with secondary ITP are treated for their underlying condition, while treatment of primary ITP depends on the platelet count and symptoms. Asymptomatic patients with a platelet count over 30,000 can be observed and often recover on their own. Patients with an active bleed or those with a platelet count below 30,000 are usually started either on corticosteroids or intravenous immunoglobulin, or IVIG for short. Corticosteroids act as immunosuppressants, and IVIG has an immunomodulatory effect. Both of them help stop the formation of new autoantibodies. In individuals who don't respond to steroids, a splenectomy can be done to get rid of the splenic macrophages that are destroying the platelets. Finally, transfusing platelets can be done when platelet count is less than 10,000. All right, as a quick recap, ITP is a condition where the spleen produces IgG autoantibodies against the platelet receptor GP2B3A, which leads to destruction of platelets. Acute ITP lasts for less than 2 months and usually affects children. Chronic ITP lasts more than 6 months and usually affects females of reproductive age. Most of the time, there are no symptoms. But sometimes individuals with ITP can have purpura or even nosebleeds in some severe cases. In general, asymptomatic ITP resolves on its own, but severe cases are treated with corticosteroids or intravenous immunoglobulin.
Epidemiology. The incidence of this disease in high-income countries is about 3 to 10 per 100,000 children per year below 16 years of age. The exact incidence of the disease in low-income countries is unknown. A study in Nigeria showed that the overall prevalence was 0.005% of total hospital cases. The percentage of children admitted due to ITP during the years 2003 and 2004 to the Department of Hematology at the Children's Hospital in Lahore, Pakistan was 4.8, out of which 69 cases were acute ITP. The disease has rarely been described in Africa, which may be due to genetic or environmental factors, or it may simply be that physicians overlook this disease when making a diagnosis. Signs and symptoms. What are the symptoms of idiopathic thrombocytopenic purpura? Normal platelet count is in the range of 150,000 to 450,000. With ITP, the platelet count is less than 100,000. By the time significant bleeding occurs, you may have a platelet count of less than 10,000. The lower the platelet count, the greater the risk of bleeding, because platelet help stop bleeding. The symptoms of ITP are related to increased bleeding. However, each person may experience symptoms differently. Symptoms may include the purple color of the skin after blood has leaked under it. A bruise is blood under the skin. Persons with ITP may have large bruises from known injury. Bruises can appear at the joints of elbows and knees just from movement. Tiny red dots under the skin that are a result of very small bleeds. Nosebleeds, bleeding in the mouth and around the gums. Bleeding in the mouth and around the gums. Heavy menstrual periods. Blood in the vomit, urine, or stool. Bleeding in the head. This is the most dangerous symptoms of ITP. Any head injury that occurs when there are not enough platelets to stop the bleeding can be life-threatening. The symptoms of ITP may look like medical problems. Always consult your healthcare provider for a diagnosis. Diagnostic workup. How is ITP diagnosed? Your doctor will perform a complete physical exam. They'll ask you about your medical history and the medications you are taking. Your doctor will also order blood tests that include a complete blood count. The blood test may also include tests to develop your liver and kidney function, depending on your own symptoms. A follow-up blood test that checks for platelet antibodies may also be recommended. Your doctor will request a blood smear, in which some of your blood is placed on a glass slide and viewed under a microscope to verify the number and appearance of platelets seen in the complete blood count. If you have a low platelet count, your doctor may also order a bone marrow test. If you have ITP, your bone marrow will be normal. This is because platelets are destroyed in the bloodstream and spleen after they leave the bone marrow. If your bone marrow is abnormal, your low platelet count will likely be caused by another disease rather than ITP. Treatment. How is idiopathic thrombocytopenic purpura treated? Specific treatment for idiopathic thrombocytopenic purpura will be determined by your healthcare provider based on your age, overall health, medical history, extent of the disease, your tolerance for specific medication procedures or therapies, expectations for the course of the disease, your opinion or preference. When treatment is necessary, the two most common forms of immediate treatment are steroids and intravenous gamma globulin. Steroids help prevent bleeding by reducing the rate of platelet destruction. Steroids, if effective, will result in an increased platelet count seen within 2 to 3 weeks. Side effects may include irritability, stomach irritation, weight gain, high blood pressure, and acne. Intravenous gamma globulin is a protein that contains many antibodies and also slows the destruction of platelets. IVG, intravenous gamma globulin, works faster than steroids. Other treatments for ITP may include Rh immune globulin, medication changes, splenectomy, platelet transfusion, rituximab, romiflostim, and eltrombopag. And lastly, lifestyle changes.